So getting into this, what we're going to talk about today, what are the lifestyle factors for brain health and reducing your risk for dementia? Then we'll talk about specifically the brain benefits of exercise and something called dual task training. Then we'll talk about a couple of case studies that put all of this together. So first, let's just talk about what normal aging looks like. Basically, these green lines at the top, that is normal aging. We may have some changes as we get older. We may have a few more word finding issues. We may not be as fast as we once were, both cognitively and mobily, but that is normal. What is not normal is this precipitous decline into this mild cognitive impairment and dementia. And that is what we absolutely want to avoid. But before that, you may have people who are experiencing kind of subjective cognitive decline. And that would be this preclinical phase where they feel like something's just not quite right, but nothing is coming up on tests yet. And so as it says here, it's a stage where the patient knows something is not quite right, but the doctor doesn't because it's not showing up on tests. Then we get into mild cognitive impairment. And that is where we can start seeing changes on tests, where you might have a cognitive test at your doctor's office, and that may start showing some issues. And it is really, really important that all of us get a baseline cognitive exam with our primary care provider so that we know exactly when or if something starts to go south. Because the earlier we can intervene, the more we can do to slow or stop the progression of the disease. And if you have a diagnosis of mild cognitive impairment, there's a higher risk that will convert into dementia. And so it's really, really important that we do the things that we know are effective to prevent that decline. Things like what we're going to talk about today. So staying connected, really, really important, not only for our emotional health, but also our brain health, because when we connect with others, we have to remember what has been said. We have to use our verbal fluency to respond, and we have to pay attention so we know how to respond appropriately. And those are really important cognitive domains that we need to maintain and keep sharp. We have to manage our stress. Now, stress is a given, but we need to have tools in our toolbox that will help us to manage that stress so that it is not so much of an issue for our brain health and overall health. And we need to have good restorative sleep. 7 to 8 hours is what we need to aim for. And I know that's difficult for a lot of people. If you cannot get that 7 to 8 hours, the next best thing is to anchor our sleep and our wake time so that we're going to bed at the same time, waking up at the same time every day, but also practicing good sleep hygiene so that we can try and get that good restorative sleep. We need to be eating right. And there is a lot of research around the MIND diet, which is a mix of the Mediterranean diet and the, here's my word finding issue for the day, the DASH diet. So a mix of the Mediterranean and the DASH diet. And to put those together and you've got essentially the MIND diet. And basically what it's telling you to do is eat real whole natural foods, eat the rainbow of fruits and vegetables, and reduce your intake of saturated fats, salts, and sugar. And the two that we're really going to talk about today are cognitive stimulation and staying active. And in particular, how when we combine those two things, we have a real synergistic effect on the brain. So the good news is that our brains have the ability to change throughout our lives. The bad news is it becomes a little harder for us to change the older we get. And so the effort is hard, is greater to elicit that neuroplasticity. And neuroplasticity involves both the creation of new brain cells. We know that the hippocampus and the olfactory bulb are the two places in the brain that can actually create new brain cells. So that is one part of neuroplasticity. Another part is creating new connections between brain cells. So when you're learning new things and experiencing new things, you're creating new connections. But also when you repeat those things, you're strengthening the connections between the brain cells, the synapses. So all of that is neuroplasticity. And as we get older, in order for that to happen, we need to be able to focus and pay attention more than we did when we were younger and things just happened a little easier. Focus and attention is something that gets difficult, more difficult as we age. It is something that can diminish. And so it's something that we need to work on. But it's important to do all of this new learning and cognitive stimulation so that we can build up our cognitive reserve. Think of cognitive reserve like your brain's fuel tank. We fill it up with our formal education early in life and any ongoing education or learning experiences that we have throughout our lives. So, and as well as any new stimulating things. So the higher that we can get our brain's fuel tank, this cognitive reserve, the less likely we're going to see that low fuel warning light when we get older. We're buying ourselves several more years of good cognition so that hopefully we don't see that decline, that mental decline that someone with a lower cognitive reserve might see. What should cognitive stimulation include? Well, it needs to be novel, meaning new to you. The brain likes new, novel, stimulating things. That is where those new connections are made, that is where the neuroplasticity happens. But we also need to enjoy what we're doing. Otherwise, we're not going to continue it. And we need to do a variety of things. So if you have been doing crossword puzzles for 20 years, and that's all you've been doing, time to take up something else. You're the crossword part of your brain, really big, fat, and happy, but we need to find something else to stimulate some other parts of the brain. And if we can socialize it, then we're getting in that other brain health factor of socialization along with this stimulation. But that socialization also usually leads to accountability because you don't want to disappoint maybe your book club or your game night crew. And then it needs to be cognitively demanding enough that you make mistakes. Mistakes are where the magic happens. That's when your brain has to figure out, ooh, what did I do wrong? How can I do better the next time? So that's when those new neurons are firing, the new synapses are firing. So don't be afraid of mistakes. Aim for a B rather than an A plus. If you're getting an A plus, it's not stimulating enough. But let's kind of switch gears now to why exercise is so beneficial for the brain. This study done by Dr. Wendy Suzuki and Julia Basso shows what one bout of exercise does for our brain. So after 15 minutes of at least moderate intensity where you're getting your heart rate up, we see all of these beneficial neurochemicals released into the bloodstream they cross the blood-brain barrier and bathe the brain in these beneficial neurochemicals. And Dr. Suzuki calls this a bubble bath for the brain, which I think is a lovely description. So this BDNF is brain-derived neurotrophic factor. That has also been called miracle grow for the brain. It is one of the best things that we can do for the brain, and it's only stimulated when we exercise. Can't take a pill. It's only from exercise. So after that 15 minutes of good moderate intensity, we have up to 120 minutes of better cognitive functioning. So when I'm giving a presentation to my younger kids, I tell them, look, if you've got a test coming up, make sure you're out getting some exercise in before that test, because you will do better on that exam.
You know what's funny? Sorry to interrupt.
Uh-huh.
I looked at this and I thought, oh my gosh, I have to do 120 hours to get better cognitive functioning. So
So no.
obviously, I didn't exercise right before this because I didn't read it right.
So yeah, no, just the 15 minutes will give us up to 120 minutes of better cognitive functioning. Plus, we'll get up to 3 hours of stress reduction and up to 24 hours of just a better general mood. Now, that's after one bout of exercise. But if we are more continuous with our exercise, these benefits tend to last longer and are increased. So really, really important to get some exercise in every day. There are three main types of exercise, and I think we all know what aerobic exercise is. That's your swimming, that's your outrigger canoe paddling, your dance. It's anything where you're getting the heart rate up, and it can be steady state, just walking, running at the same pace, or interval training, like high intensity interval training. Probably your Zumba might fit into that as well. And then strength training, really important for all of us, and especially as we age. We've got to keep those muscles and bones strong. So the more we strength train, the more we're also putting stress on our bones to help prevent osteoporosis. And this closed skill and open skill training, I'll get into that in the next slide. But then there's this neuromotor training or skill-based training. And that is where you're using your body and your brain at the same time. Now, you can divide that into your mind-body exercise, which is your Pilates, your yoga, your Tai Chi, and then your skill-based training. And that is your sports, your dance, your martial arts, and dual tasking, which we'll get into in just a moment. But think of it as that skill-based is anything where if you have to react to someone or something. And let's just go into what the difference is between open and closed skill exercise. So open, again, the environment is always changing. You're having to react. So think of your pickleball, think of your table tennis or your martial arts, your surfing. You're having to react to what all the environment is doing, and even the people around you. So that is really, really good for our reaction time, our impulse control, our executive functioning. Now, closed skill exercise, stable and predictable. So think of your treadmills or just running, going for a run. You're not really reacting, you're just going for your run. But that is also good for the brain, because you tend to get into kind of especially with your yoga and Tai Chi, you're really internally focused and working on attention, which is important for us. The main thing I want to get across is that all of these types of exercise are good for the brain, and every type of exercise impacts different parts of the brain. So our strength training tends to affect more of the frontal lobe where our executive functioning is, which I'm not quite sure why that is. And I think the researchers are still trying to figure that out, but I find that very interesting. And then the aerobic exercise tends to affect more of the temporal lobe where our memory center is. So aerobic can have a good effect on our memory. And then the dual task training and open skill training tends to have effects on the parietal, occipital, and cerebellum. So think of your hand-eye coordination and just general coordination and needing to react to things. So if you can get a little bit of different types of exercise in during your week, you're really having a wonderful impact on your brain. So let's talk a little bit about this dual tasking that I keep bringing up. First of all, it is not the same as multitasking. Multitasking is when you're trying to do two cognitive skills at the same time. So think of trying to scroll through Facebook while also watching a television show. You can't actually do that at the same time. And so you end up doing attention switching. So your brain is quickly going back and forth between the two things that you're trying to do. And that has been shown not to be good for us because it reduces our ability to pay attention and focus, which is exactly what we need to be doing to help for a healthy brain. So why is dual tasking different? Dual tasking is when we are doing a cognitive skill plus a motor skill or a physical task at the same time. And we do that in everyday life. And there are examples here on this slide: walking or talking, writing and listening, writing a phone number while listening, but also, maybe you're in a cafeteria, you're carrying your tray while you're searching for a place to eat. And when we're younger, these things are pretty easy. We don't even think about it. When we get older, requiring a little more processing than sometimes our brain is able to do. So by dual tasking in a clinical setting or a community setting, we're able to improve our ability to do everyday dual tasking as well. So this is a study that came out last year, and it shows that all exercise is good for our brain, for global cognition, memory, executive functioning, and so on. But it's also showing that the exercise plus cognitive, i.e. dual tasking in this purple, that is showing greater benefits across these cognitive domains, except for processing speed, where it's right in line with the multimodal exercise. And multimodal means different types of exercise. So perhaps you're doing aerobic plus strength training, or Tai Chi plus aerobic. So again, all exercise good, some a little better than others for these cognitive domains. And why is dual tasking better? Well, it is really focusing on our executive functions, our planning, our organizing, our impulse control. And so it's helping to improve our attention and processing speed, which is part of that executive functioning. But more than that, it's enjoyable. It's almost like a game. And I'll show you some examples of that. So with that, you tend to have better adherence, and especially older adults, they tend to, they have that, they're having fun, so they're going to keep doing it. And as it says here, it improves cognition more than the single task exercise, as we saw in the previous slide. So let's get into some case studies. And the first one is a 78-year-old male who I have been training for a little over a year now. And he had a heart bypass surgery a few years before COVID. He's actually had four same eye, detached retina 4 times in that eye. And that is, if you've ever had a detached retina, you know what a pain that is. You basically have to stop training or doing anything. You have to sleep on your face. It's just not fun. So he's had to, I do not wish it on anyone, but also cataract surgery, knee issues. And interestingly, that was what brought him to me. He said, I don't want to go for surgery on my knees. I want to try and, get out of that by starting an exercise program. And then he also had SCD, which is subjective cognitive decline. So again, that is where something's a little different, but it's not showing up on tests. And I am assuming it was subjective. He had not had a cognitive assessment, so we don't have that information. But we did the initial assessments, and his 30-second sit to stand, he was in the 15 to 20th percentile for his age group, so pretty low. Grip strength was also poor. And I didn't mention, he really had not been doing any exercise since COVID. He was doing a little bit after his heart bypass. He had been doing things. He had lost the weight that he needed to lose, but then COVID hit and nothing. So so his strength went down. His just assessments were lower than they should have been. This timed up and go is an 8-foot up and go. So you sit up, you stand up from your chair, you go around a cone 8 feet away and come back to sit down in the chair as fast as you can. DT means dual task. So we did it once without the dual task, and then again with a cognitive, asking him to count backwards by 3. So stand up, start counting backwards from a given number, so 197 and so on. He had the difference between his single task and his dual task was 26%, and ideally we want that to be 10% or less. So interventions, we started training twice a week, and that was aerobic he had a stationary bike. It was strength training, and we were working on gait because that was really affecting his knees. He had muscle imbalances that were affecting his knees, so we were really working on that. And also Pilates. So some of that mind-body, the attention, a little bit of that's also the neuromotor exercise. So we had the aerobic, we had the strength, and we had the neuromotor. But I also added in some fun dual task at the beginning and at the end of each session. So after 6 months, we got his sit to stand up to 50th percentile from the 20th. Grip strength increased from poor to fair, and his dual task cost decreased from 26 to 13%. So very close to that 10% where we want it to be. Now, he goes to the doctor every 6 months, and these assessments were done over a year ago, and he just went to the doctor a couple of weeks ago. In that time period, I had been trying to get him to walk and could not because he would have his 2 sessions a week with me, and then he would go and sit in front of the screen, whether it was his iPad or the television, and he would not get anything else during the week. It was just very sedentary. There's only so much that 2 sessions a week, 2 hours a week can do when you've got all of these other hours. So I finally got him to start walking by signing him up on an app. It's called Step Up. It's free. And it gave him the kick in the pants that he needed. So because I could then see exactly how many steps he was getting every day. And I could send him little, encouragement, but what he loved most of all, whenever he reached his goal, he got this confetti explosion on his phone, and he is addicted to that confetti explosion now. So that was the reward he needed. And so at this doctor's appointment, after 1 month of walking, from the previous 6 months, he had lost 10 pounds. His blood pressure decreased by 10 points, and his blood sugar had gone into the normal range from the pre-diabetic range. So the power of walking is real. So, and he's also now able to keep up the grandkids. He's using the stairs better. We're still working on it, still have some imbalances, but he's also subjectively feeling sharper. Now, this is a facility in Maryland, and I'm including this because the study was just published last week, so we have some real data on the dual tasking program here. And it took this community dwelling individuals and put them through 2 bouts of dual task training. So we had 75 adults, and the purpose of the study was to look at, could we see a change in cognition over a long duration, which in this case was 1 year, but low frequency. So there were 2 separate 8-week programs over the 12 months. And for a total of 16 to 24 sessions per person. And this was a mix of dual task training and clinical exergaming. And the clinical exergaming meaning that we have these different types of equipment that you see here. This first one is called a Smart Fit, and we're able to play different types of games on it depending on what cognition, what cognitive domain we're trying to target, whether it is attention or memory, impulse control, or the like. And then the DV Senso on the right-hand side, that is also working on balance while you're also paying attention to the screen in front of you and reacting to what's happening. And just to give you an idea of what the Smart Fit does, let me just see if this is going to play. Yep. So she is looking for a very specific number in the sea of other numbers within this, and it's increasing by 2. So she's starting at 0, has to look, and then has to look for the 2, then the 4, then the 6, and so on. Here she's doing it just single task, and then the second time she would add a dual task, a physical task like marching in place, like a sit to stand, or a lateral step pattern. And then we'd see what the difference is between the 2. So the results of this was, first of all, they had a 75% retention rate, which is very good. So very few people dropped out of the program. They saw a 1.5 median increase in MoCA scores and a 3.5 point median increase in CNS vital signs, which is very good. And again, that was after about in the beginning of the 1-year program and then at the end of the 1-year program. And so we were able to show that you can maintain and even increase cognition, even if you're not doing it very often. So what is a brain healthy exercise prescription? Well, first of all, we have a raised hand.
We have a quick question. How does piano playing figure into this?
Yeah, very, very good. Yes, so any musical instrument, very good for cognitive skills. So yeah, and you're certainly using your physical skills plus your motor skill. You're just not getting the heart rate up, which would be ideal, but piano playing, very good.
Unless you're playing in public and then you're nervous.
Yeah. And that's stress, but it's acute stress, which goes away afterwards, so that's okay. All right, so what we want to get at least 150 minutes of moderate intensity exercise each week, and that is from the World Health Organization, that's from the American College of Sports Medicine. it is really, it should be doable for everyone because it's really only 21 minutes a day or 30 minutes 5 days a week, or however you want to mix that up. We want to ideally get a different mix of exercise. So if you're only running, for instance, try and add some strength training to that. It'll be very good for many things. And then if you can get some neuromotor training, so I would add that outrigger canoe paddling to that. You're definitely reacting to other people and to the environment, as well as your surfing, your pickleball, table tennis. Table tennis is probably the easiest. We have portable table tennis, but you can take pretty much anywhere. And then, yeah, so here's your examples of that. And then we want to incorporate cognitive demands into the exercise if we can, or at least 30 minutes a day of some sort of cognitively demanding skill that you're working on. And that could be a game night. It could be reading a novel. But if you can incorporate it with your exercise, bonus points. And we need to make it enjoyable because otherwise we're not going to stick with it. So with that, what questions do we have?
There is one. What would CrossFit fall under?
So we definitely get the aerobic and the strength, and you may get some neuromotor if you are doing things where you're reacting to a partner. And so the partner may be randomly throwing you a weighted ball while you're doing something separately. In fact, that's something that I have my older adults do, is they're walking a ladder and they're trying to maintain a certain foot pattern, and their partner is just randomly throwing them a ball, and they have to catch that while maintaining this foot pattern. I'm assuming this is 30 consecutive minutes. No, thank you for that question. So we can split up our exercise throughout the day. And in fact, some studies are showing that that may be better, especially if you're someone who may just do all of their exercises first thing when they wake up, and then you're sedentary the rest of the day. You're almost negating what you did first thing in the morning by being sedentary the rest of the day. So that I go back to my client who, he'd have his 2 hours of exercise a week with me, and then he'd sit on his Acole the rest of the day. And it wasn't until he really started walking that we saw those big changes in the blood pressure and the blood sugar and the like. So if you can absolutely divide up that 30 minutes into 3 10-minute bouts or 2 15-minute bouts, or however you want to do it.
I noticed that the picture of the research center, it looked almost like that Wii Fit game where you dance.
Yes, and that is absolutely, that's kind of the grandfather of exergaming, which is what, let's go see if I can go back to that. Nope.
And that's what kids like to do. So you could do this with your grandkids, right? If I had any.
Yeah. Yeah, I'm trying. Okay, so yes. So yeah. The Wii Fit and the Dance Dance Revolution, if anybody remembers those, those were the granddaddies of this clinical exergaming that we're talking about now. So you can absolutely, if those are still around, they're great things to add to your repertoire.
So yeah, I'm thinking getting one of those and staying more cognitively fit. I'm going to look it up right now.
Yeah.
Any questions, comments?
We have a comment from Taryn. I recently read that handwriting for 15 minutes a day makes the largest impact, more than exercising and diet. Is that true?
I have not heard that, and I'm kind of skeptical. Has anybody else heard anything about that? Because we really want to get the heart rate up, and that's because that's what is releasing the the beneficial neurochemicals into the brain. Now, I'm not saying handwriting isn't bad. That is good for our cognitive stimulation. So you want to get about 30 minutes of cognitive stimulation, whatever that is, each day, and handwriting can be part of that, or creative writing can be part of that.
So they do.
Oh, sorry.
Oh, no, go ahead. Go ahead, Morgan.
All right. So someone told me that older adults with cognitive decline benefit from speech language pathology services too. Of course, in addition to exercise and such. Is that true? I believe that is true. It's not something that I have a lot of experience in, but I do have a speech language pathologist who comes in to talk to my older adults about the importance of hearing health and being able to swallow and all the rest. So, that information is very useful, and especially for Parkinson's, people living with Parkinson's, having a SLP, really, really important. Walking and listening to an audiobook, yes. So you're getting that physical part in, plus listening to an audiobook, so you're trying to retain the information. That's absolutely something that you can do. Music, I think of that as more of a stress relief. When I'm out walking and listening to music, it's more of a stress relief, not really engaging the brain so much.
I'm busy looking up Dance Dance Revolution for in-home use.
Okay. What do you
And some
think
people are building their own, but it does exist. Like there's those dance pads and stuff, but I think you want the bar too. So anyway, it looks like fun.
Yeah. Yeah.
I think
And then this is not exercise, but what do you think about people who are bilingual? So learning a new language, absolutely wonderful for the brain. And it is something that we can do any time of our lives. What we tend to do as we get older is we get fixated on the memorization part of learning a language. And so we're on our Duolingo or whatever it is, and we're just memorizing, but we're not speaking the language. And we wonder why we're not. Speaking the language is using an entirely different part of the brain than memorizing those words. So speaking language, good, because you're using a different part of the brain, but B, that is what is going to get you fluent. And as we get older, we're more reluctant to speak that language because, someone's going to laugh at us. Let it happen. That's again where the magic happens. When you're making mistakes, your brain has to figure out how to do better the next time. And virtual solitaire. Well, if you're playing with others, that could be a little better, but there is some cognitive stimulation there. However, if you're playing it, if that's the only thing you're doing, after a while your brain is just not stimulated enough. So we go back to that variety. We need a variety of things, and we need to make sure that it is stimulating enough that we're still making mistakes and have to really think about it. Okay. And I can also, so this page or this slide does show, again, things that we're using with equipment, but we can absolutely do dual tasking without equipment. And I can lead you through a session or a couple of exercises where we do that. Should we do that? I'm going to ask everyone to stand up. Let me get this so that I can stand up. And I'm going to label everyone's arms and legs with a number. So your right arm, will be 1. Okay, so just I'm mirroring you. Your left arm will be 2. And your right leg, which you can't see on me, is 3. And your left leg is 4. And when I call out the number, you're going to raise that arm or leg. So let's start with 2. And that would be, yes. Oh, sorry. So 1. Yes, sorry. Sorry, I was mirroring and then I wasn't mirroring. Okay, so this was this was 2. So 1, 2. Okay, let's see if I can get my brain engaged. All right, so let's do 1. Okay, good. And 3. So that would be your right leg. And 4. Good. That would be your left leg. All right, so now I'm going to give you 2 numbers, raise them in succession. So 1, 2. Excellent. 3, 4. 3, 2. Okay, good. Yep, 3, 2. Did I do that wrong again? I'm I'm just gonna let you guys do it. And then 4, 1. Okay, now I'm going to give you 3 numbers, again, in succession. 1, 2, 3. 3, 2, 4. Okay, 1, 4, 2. Exactly. Okay, now I'd like you to do it in the reverse order that I give you. So if I say 1, 2, 3, you're going to do 3, 2, 1. All right. 4, 2, 1. So that'd been 1, 2, 4. Okay. 3, 2, 4. So 4, 2, 3. Excellent. 1, 3, 1. So yeah, trick 1. Okay. And now I'm going to give you a very easy math equation, and you're going to raise the limb that is the answer to that equation. So let's start with 2 plus 2. So you would, yep. And 1 plus 1. 2 times 2. 20 minus 19. And 98 minus 97. Excellent. Okay, so you've got an idea. And there are many, many different things that we can do for dual task classes like that. Link to the free Step Up walking app. Yes, I can try and get that to you. You can go to the App Store and just type in Step Up, and you'll get a link to that. And let's see. Any other questions that I missed?
I had a question while we were doing the exercise, and then I forgot it, of course. So, um, hmm.
That's a cognitive issue.
I know. I was doing my exercises. Um, let's see. Um, Anybody have other questions or a case? It doesn't have to be pertinent to this topic. Well, I'll ask. So my husband and I do, no, we do Wordle every morning while we're walking the dog, and then we listen to a book later. But it sounds like we should be learning Hawaiian while we're walking the dog, because that's more challenging maybe than, we're always trying to learn how to do Wordle better. But still, I think we may have settled in our, maybe we shouldn't settle in on just doing the Wordle.
I love that you're able to do Wordle while walking the dog. I'm not sure I could do that.
Oh, they're four hands, so it's okay. Um,
But yeah, I
but
mean, that is absolutely dual tasking. So great job.
all right. So I thought of my question, and it is, what kind of cognitive assessment do you think we should get at our doctor's office? Because maybe we should just do it at home and have it, and then, in case they don't do it.
So there are options that we can do at home. And the MOCA, which is a clinical assessment, has recently come out with an at-home cognitive assessment called MOCA Chai. And
I love chai. Sorry, I love chai, and that's perfect.
so I need to find the link to that to provide in the chat, but that is one. And then AARP actually has a good one as well. And that is at the Staying Sharp website. And sorry, I'm just trying to dual task here, or actually I'm trying to multitask, and that is not good. But I will find those links and drop them in the chat for you.
Thank you.
But yes, so a lot of times your doctor is not going to bring up a cognitive assessment at your annual exam because A, they have very limited time, and B, if they say, oh, I think we should do a cognitive assessment, how is that going to make you feel?
Yeah,
So,
old.
so my husband recently had his annual, and he went in and said, I would like a cognitive exam. I am just like, just not as sharp as I feel like I used to be. So they did the full cognitive. I think they did the MOCA. And so you can absolutely advocate for yourself. And most times you probably will need to get that baseline cognitive assessment.
I'm sure they do it when you go to the geriatrics clinic, but then you're admitting you're old.
Yeah.
I just had what I call my old people vaccines last weekend, so I'm admitting it, but yeah, my pneumovax and my zoster, my um varicella. Have you heard of any connection between lack of B12 and dementia?
So there are studies that show that older adults who take a multivitamin can reduce. B12 is one of those vitamins that a lot of us are deficient in, especially if we don't eat a lot of meat. So I rather than a lot of my older adults come to me and say, oh, what about this thing I saw on late night TV? I'm like, save your money. But multivitamin could be a good thing to add. Okay, so I added the link to the espresso mocha, and then within that there's something called the mocha chai. So they're really trying to
Love
go all
it.
over the coffee there.
Yeah, when I Googled mocha chai, you know what I got. I got all
Yeah,
kinds of drinks.
exactly.
I even spelled mocha right still. How about now I forgot again what I was thinking. Oh, I recently heard that there was a study that said that if you get your shingles vaccine, you're less likely to get dementia.
I have also heard that study, and that's all I can
And
say.
that was the vaccine I couldn't remember the name of that I was just mentioning.
And
So
so
obviously I needed it. Oh my
yeah,
goodness.
so I had shingles when I was 50. I do not want that experience again. So next time I'm at my doctor, I'm getting that vaccine. It is not pleasant.
You can go to Long's or Walgreens and get it. Apparently, a lot of doctors don't have it in their office, but they say just make an appointment. And yeah,
All right.
yeah, it hurts. But hey, if you don't get dementia, it's worth it.
Yeah, and it's going to hurt a lot less than getting shingles. Trust me.
Yeah.
Okay, so that long link that I just put in, that's the link to the Staying Sharp cognitive baseline test. That is, I like that one because once you take it, you get your score and it compares you to your peers. And then it gives you options for improving your score next time. And when I took the mocha chai, I had a bit of test anxiety. So I did not do well the first time I took that test. So I just want to tell everybody, take a deep breath, chill out. It's going to be okay. And then take the test. And if you don't do well the first time and you think, oh, I was just a little stressed out, come back to it another time when you're feeling a little less anxious.
And Naomi says she thinks the article stated that shingles increases the risk of dementia, which would inversely imply but not prove that if you have the vaccine, you're less likely. I'll look up the article. And then there's a comment here. Esther says, when I forget something, I go back to where I came from to remember it.
Yes, that is actually a very good strategy. So walking into a room, not remembering why, happens across the ages. It happens to us at any age. And one of the best ways to remedy that is to go back to where you came from, where you had that desire to go into the room, and look for the cues that will tell you why you were trying to go into that room in the first place. So that's a really good thing to do. And Christina, you had a question.
Yeah. I'm sorry I came in late. I wish I could have watched the whole thing, but I'll have to watch
But you
watch
can.
it later on. Yeah, watch it later on. Two things. One is a comment, one's a question. The comment was that my sister-in-law, she thought she had early onset dementia, and she has a very, very stressful job. She's retired now, but a very, very stressful job. She's a federal prosecuting attorney, and her sleep patterns were all over because when she's prepping, she doesn't get enough sleep, etc. So she went in and took the test, and sure enough, it showed early onset dementia. She thought, and then she retired, and she actually got enough sleep. She went back in and she took it again, and it was fine. So it actually forced her to retire, which was the best thing that ever happened to her, quite frankly. She loved her job. She loved what she did, but it was just the sleep patterns were just, she would stay up sometimes 2 whole days and maybe sleep 1 hour, 2 hours getting ready for court. And then my other question to you, and maybe you talked about it earlier, but I came in late, was dance. I'm a dancer, and I have seen a lot of research. Things come up because of what I look at, I guess. The different research about dementia, about memory and gaining of neurons in the brain, as well as overall feelings, the endorphins, all those sorts of things. So I don't know. I didn't hear everything that you said, unfortunately, but did they talk about that at all, especially because of crossbody and learning new moves, physical moves?
Yes, dance is a wonderful thing for your body and your brain. It is because of all the things you just mentioned. I mean, we've got music that we have to respond to. We've got a partner that we're responding to, or other people around, and we're having to memorize the moves and while moving our body. So really, really good. And going to your first comment, thank you for that, because I neglected to mention when I told everybody, you should get a baseline cognitive assessment. One of the reasons for that is because there may be underlying issues that are causing your, causing you to get a lower score, causing this cognitive issues that you're having that have nothing to do with dementia. It could
Mhm.
be polypharmacy. It could be even a UTI. It could be, these terrible sleep patterns. And once you're able to remedy that, a lot of times your doctor is able to go through all of the options and issues and help you remedy that. And you find that you're actually fine.
Yeah. Thank you.
Other questions or comments? Oh, there is one. Let's see here. I believe that any infection or even injury can affect brain function. Long COVID, for instance. Oh, yes.
Mhm.
Let's next week, we're following in this bent, and we have laughter and mental health, a nervous system based tool with Joni Acola, whom I don't know. That's going to be interesting. So, thank you, everybody. And remember, we have $150 if you present a case. It's super easy. You can just email me your case. I can present it to the group. So you can do it anonymously, or you can present it, or you can have an inspiration on the day of and say, hey, I've got a case. So, we will see you next week. Thank you so much. This was wonderful.
Thanks,
I'm going to get
everyone.
my dance revolution at home.
Or your ping pong set, or portable ping pong. Yeah.
Yes, portable ping pong. Well, we have, we could do that. All
All right.
right. Take care,
Thanks,
everybody.
everyone.